Trochlear nerve?
Pardon?
Trochlear?
It's not really one that you look at too much because it's it doesn't do a lot. So it's mainly the oculomotor is the one you need to remember on that one. What are the other two things that you see when you have oculomotor damage in that eye?
The downward gaze?
Paralyzed medial gaze.
The eyelid.
And droopy eyelids, yeah.
And the droopy eyelids, what I was looking for,
Pupil dilation?
and then pupil dilation. You do lose some of that downward gaze, but I'm not gonna make y'all remember that. I'm more concerned that you know that they've lost the medial pull, because it's the stronger thing. But, so they've lost the medial pull, they have a droopy eyelid, and a pupil that's dilated. And you have oculomotor damage. Okay.
Cranial nerve.
If you have dysphagia, what is that?
Is it this disturbance of swallowing?
Yes, and what two cranial nerves are involved with that?
That would be.
Is it glossopharyngeal and vagus?
Yes, very good, okay.
Cranial nerve.
Yes, they are before they get to
I don't
you.
like when they take on.
If you have a drooping lip when someone smiles, what nerve is affected? Facial. I have a little friend who, yesterday had surgery. She's 11. And she was born with a genetic thing where they don't have much of a chin. And so they normally can fix this when they're like 3 or 4, but she's never been able to do that. It's never been successful. So yesterday they went in and put in 2 TMJ apparatuses to replace the ones that what happened is they tried to replace them 9 months ago and she got infected. So she has been without any jaw joints for 9 months because they had to get that all cleared up. She has a trach, but they had trouble even getting those in yesterday. So, but one of the things that I'm concerned about is the right side of her face is not moving. So we will see what happens there. And she's just coming out of it. She's really pretty traumatized. But anyway, it's, I'll keep you updated on her. It's very interesting. Okay.
Let's get one cranial nerve in. Okay.
If you have trouble chewing, which cranial nerve is involved? And which division is that? Good, okay. Oh, you know.
No.
I was like, she's staring at me, I'm like, no, I don't want to do this again.
Cranial nerve.
Right on his table.
What does the motor function of the tongue?
What's the motor function of the tongue?
I know, because I missed a lot of those on the test. That's what yeah, I believe that one. We could have done that. Yeah.
Hypoglossal.
Hypoglossal, good. What does the sensation of the tongue? Actually feeling in the tongue.
Hypoglossal?
No.
That's the one that has the two different ones, right? So it's.
No, you're talking about taste. I'm talking about just feeling the tongue, for someone to touch it and you feel it. What is that? Which cranial nerve?
Glossopharyngeal?
No. Anybody know?
Facial.
No, not facial.
Trigeminal.
No.
Vagus.
It's trigeminal.
That's what I said.
Does the sensation of the tongue. Remember, there are four nerves involved with the tongue. We'll go over the taste, but motor is hypoglossal, and sensation where you actually feel, and their pain and everything is your facial. I'm sorry, trigeminal. Trigeminal. Okay. Go back over here. And do cranial nerves.
Spinal cord injury 1.
What is the sensory dermatome for the back of the head?
Two.
What two?
Is it C2?
C2. Y'all get that cervical, thoracic, lumbar, sacral in your brain. Remember how those come. Okay, make sure you say cervical. Think about that. Okay. How much I like?
Paraplegic.
I don't know. I don't think it's
What
been a minute or
level
like.
does plantar flexion come in at? F1. And what are the major muscles of plantar flexion? Gastrocnemius. What's maybe one other that might be down there? That is correct. They are definitely the major muscles, but what else is back there? It does also an S1 muscle.
Is it one of the ones that does, eversion?
You know, I don't know if it does or not. I just come to it off my head. I don't know. What were you gonna say that?
What is like the longest one? What are the
Drawing a blank here.
You got them?
Hamstring?
No, it's posterior, tibialis posterior.
Oh.
And I don't-
I was gonna say
does it
hamstring,
go
but I
into
didn't
the
think
femur?
it was.
Yeah,
I don't think
I
it
didn't know, I was
does.
like-
It's just straight plantar
Yeah, I was
flexion.
like,
maybe, that's the only thing I was thinking of.
yeah.
Okay, Scott and Noah.
We'll take quad,
Quad.
the saw.
What are the chord levels for the diaphragm?
C3, C4, C5.
C4, C5. What level can they possibly be off a ventilator at?
C4.
C4 and below. Okay.
We'll do the para level.
Where does hip flexion come in at?
Is it, L2?
L2, okay.
That's, para level.
Para? Where does weak knee extension come in?
L3.
And what is that muscle?
The specifics? like a specific name for quads or like?
No, it's just the quadriceps.
Okay.
They pretty well all come in together, they're just weak at L3. Okay,
Quad levels. Quad level.
what is the cord level for the brachioradialis?
C6.
C6, okay.
I guess.
What quads or pairs? Or you want spinal cord? 1, 2, or 3? Okay. What is the sensory dermatome of the pinky finger?
I do. I think it might be C6, but I might be wrong. No. Oh, okay.
The way I remember it, it goes 6, 7.
Oh, okay.
I don't know. You guys know the dermatome for the pinky finger?
What did she say?
She said C6.
I think it, well, this one was C7, so C8.
C8T1. Okay. I guess y'all get another one, what would you like?
Quad levels.
What is the cord level for biceps?
I don't think so.
You said bicep.
Biceps.
C5.
C5, and then what's the next one?
C6.
C6, so it's actually both. C5, if they're a C5 quad, it's weak, about a 3 strength, 3/5. And a C6 would be a normal bicep strength.
I have a question, so, if it's like if the answer is like C8 with T1 always go with it?
Actually, it does for me. I was noticing on that sheet that it didn't, but yes, for me, C8, T1 always goes together, okay?
Let's go quad levels.
I actually, in my career, have only worked with one C8 quadriplegic. Why is that? Why do y'all think that would be a very rare thing?
Can you say that again? I'm sorry.
I have, in my career, I've worked with one C8 quadriplegic. It was years ago. And, why would that be the case? Because that is the beginning of the rib cage. And so you've got that C7 that sticks out, the C7 kind of sticks out. So your C8 is between C8 T1, right? Your C8 nerve. And so if your neck's gonna give, it's gonna give above that. So if it gives above that, then there's C7 quad. Does that make sense? So you're more prone to break at a different area. So I have no idea why that guy was C8, but he was. He literally broke his, and he may have had an anomaly. Somehow his spinal cord nerves were just a little different or something. But anyway, that is very rare. As far as I'm concerned, I've never really, just that one time. Okay, where are we? Okay.
You haven't answered this question.
I have, you said quad. What is the cord level for wrist extensors?
C6.
C6, good, okay.
We'll go, spinal cord too.
What is the highest quad level that can independently push a manual wheelchair functionally? And push a manual wheelchair functionally by themselves. What's the highest quad level that can do that?
C6.
C6. So that is your level of independence. So what does that mean?
They're independent.
They are independent. They can live independently. It takes them 2 hours to get out of bed, but they can live independently. They can drive a vehicle. They can get in and out of bed by themselves. They can dress themselves. They have the capability to do that without help. Do many of them do it? Rarely. But it's a lot of energy to do that. You see young men and young women do it, but as they age, then they'll pay somebody to come and dress them in the morning. Because it takes all their energy, especially if they do an 8 hours of work every day. So they'll pay somebody to come in and help them and bathe them and dress them, and just so all their energy isn't going into just getting dressed in the morning. So a lot of they have the capability to do it. And initially you see that. What if I had a 42-year-old female that was in a car wreck and was a C6 quad? What, is she capable of being independent? Yeah, she is. Is it gonna happen? Probably not. Because it's so much energy level for her. So it's just, just to think about those things. There's a lot of psychosocial things that go into life, right? Besides just, oh yeah, they have the capability of being independent. Okay.
Do you think it has anything to do with like their activity level before the injury?
Absolutely, yeah, because to start with, it helps that they were strong and healthy before always. That's really true for any patient that you have, so yeah. And the determination that they have. Some of them are extreme. That young man that we saw, how old was he, 15? He's independent at C6, so will he stay that way? When he turns 50, will he still be independent? We don't know. We'll see. I won't see, but anyway, somebody else. Okay, where are we?
Right here, I think.
Okay.
Quad.
Cord level for the deltoids.
C4.
Deltoids, it's not C4.
C5.
C5. It's C5. You guys, I have thoroughly thought about whether wrist flexion comes in at C7. It does not. You do not see it with spinal cord injuries. They do not have wrist flexion at C7. You may see it with a normal person, but if you're dealing with a quad, it's not the case. I'm sure of that. So that's on your,
That other paper?
yeah, that other paper. I'm sure that wrist flexion does not come in C7. Okay, what would you guys like?
Parallel.
What is the spinal cord level for hip hikers?
T12.
T12, okay. What is the spinal cord level for weak ankle dorsiflexion?
L4.
L4, and what is that muscle that comes in at L4? Did you not let him help you? Oh, he's laughing at me, okay.
So is it the tibialis anterior?
It is, and what is the function? What do you see? What kind of muscle movement do you get with the tibialis anterior? Dorsiflexion is one, what else is major there? Well, put your foot down there and do it. See what it does.
I'm doing it right here.
Okay, so what's the other bit, what else?
It's not inversion and eversion, is it?
It is inversion, not eversion, inversion.
We didn't learn that one all day.
It's dorsiflexion inversion. Because think about that, you know, where you can see that tendon. So it pulls up into in. Pulls up and in. What pulls out? What pulls you out in the eversion? What are your major everters?
Tibialis posterior.
No. Well, it's not a major one. I need to look that one up to see what else it does. Somebody look up tibialis posterior and see what else it does besides plantar flexion. So your major everters are your perineal muscles, but they're not called perineal muscles anymore. What are they?
Percutaneous? Is that the same thing?
No, the perineal, the longest and the proneus longus and brevis and tertius are your everters. But is that what they're called? They've changed things on me.
The tibialis posterior says inversion and plantar flexion.
So it does inversion just like the anterior tibialis does inversion. Okay, so y'all know that now. Plantar flexion inversion on the tibialis posterior. It is not a major plantar flexor. What are your two major plantar flexors? Gastroc does it with a straight knee, right? Which one does it straight knee? Gastroc is stronger that way. You do a better stretch there. Is that right? Soleus. Okay, whose turn?
Spinal cord injury one.
What is the sensory dermatome for the lateral malleolus? And where is the lateral malleolus?
It's your lateral. You okay? Down goes. Are you okay? Thank you, yes.
I'm gonna take a shot in the dark.
Is that L5?
L5, very good.
Nice job.
Good recovery.
What else is L5? That's a major thing you need to know. Lateral malleolus, but probably more major when you get into orthopedic injuries is what? I know Bill shared it with you. Sensory.
Would that have to do with the knee?
No.
Okay, so we're getting 2 points. So is this, are you talking like sensory or like?
Sensory, not motor, sensory.
Okay.
Other major L5 area that Bill's taught you about. I'm sure he has, but maybe he hasn't. We just talked about it one day in class.
Isn't
We
it
need to know this.
the outside of the
Big
leg?
toe. Big toe. Why didn't you say it?
I'm too shy.
Big toe.
It's kind of part of the top of the foot too, right?
Yes, it is, but what you're gonna learn here are just major ones. Unless you wanna memorize all that. Okay.
My dad has some problems and like he can't feel part of his foot and they told him that he had L5 and S1 stuff, so
So he has L5S1 nerve impingement.
I think so.
Okay.
He was in a car wreck, got hit.
Well, and what you need to check on him is to see if the bottom of his foot is numb, and to see if he has full, can he come
He
up on
has
that?
drop foot.
So he's not, drop foot would be what?
The one
So that'd
that's the
be,
planner.
there's your dorsiflexion. So what sensory level is that? I mean, what spinal cord level is that?
L4.
And L5. So if he's an L5S1, then probably, he may possibly have a little dorsiflexion that could be strengthened. So you need to evaluate him.
I'm trying,
Okay.
but I don't know enough.
But see if he has any dorsiflexion at all, because if he doesn't, then he doesn't. He's also affected at L4. See if that tibialis anterior can, bring that foot up, have him bring his foot up, and then resist it.
I was practicing the berg on him,
Uh-huh,
and when we got to the part where he had to put his foot up on the stool, he
uh-huh.
couldn't lift it up to on top of the stool.
He couldn't lift it because the toes drug,
Well, not just because of the toes, he just couldn't lift his leg that high.
so he could not do this. How old of a man is he?
How old is he?
Uh-huh,
He's 50.
50. You need to check his hip flexion. What, is he tight? Find out what's caused that.
Yeah, he
His
was workers'
PTA may
comp,
work him
so
over.
yeah.
Because why can he not do that? I mean, if he can't pick that hip up, then what's going on there, we don't know. I mean, is he just tight? Is he
Yeah.
tight in his quad?
I
Because
don't.
remember that your glute muscles are like L5, S1, S2. So his glutes may be weak.
Yeah.
So can he climb stairs?
He can, but it takes him a long time. Like, I don't know. It takes him a while.
But it's just on one side.
Yeah.
Just to make you think about it, you know, because we're gonna get more into the peripheral nerves. This is more spinal cord that we're talking about. So don't let this confuse you.
Yeah. That's why I wanted to.
But he really would be interesting to just evaluate and see, because he should have some, glute weakness on that side. So you might see that when he walks, he has Trendelenburg, because that would be, L5S1.
Yeah.
Okay, where are we?
Right here.
What is the sensory of the face? We're not going there. We're not going there. So remember, there's not a dermatome level on the face, it's the trigeminal nerve. Remember that, okay? See two on the back of the head, and the face is the trigeminal nerve. Okay?
Two.
There were 3 trigeminal nerve questions on the licensure exam that Michael took. Just so you know. He had 3 questions. I said, did you get them right? He told me he did, so. Anyway.
So do you get to see all of the questions you got and the answers and stuff?
No, you just have to remind them, you won't see the answers. You're gonna go in, take that test, and you're done. You will never see the answers of it. So he's not sure he got them right. I mean, he knows what but no, you don't ever see the answers. You don't get to check your test. You're gonna walk out of there and you're gonna think, I failed that. That's the first thing you think. Everybody thinks that, it doesn't matter.
How long does it take to give back, do you know?
You have 3 hours.
No, I'm saying, so it tells you right after you finish?
No, you have a week,
Oh, okay.
sometimes a week and a half.
Why does it take so long to grade if it's online?
200?
Because they have people that cheat and they have to check on all that.
That's torture though.
How would you
You guys, I waited 7 weeks to find out about mine. So, quit complaining, okay?
What did you do during those 7 weeks?
I was working, so I just kept working. Definitely you worked on temporary license then. I worked 4 months on a temporary license before.
I wanna know these words.
Because it was quarterly, like y'all had to do it, so I went to work in May and then I took my license exam the end of August.
I was gonna ask you, how long is the PT licensure exam?
It's the same,
It's the
it's
same?
3 hours, 200 questions. And 50 of those questions are just ones they're throwing in to see if they're good questions. So that's why you always think you failed, because 50 of them, they don't even count. They just are checking to see if they're good questions or not. But 150 of them count, and you need to get about 100 of them right to pass. Depends on the bell curve as to if it's 96 up to 102 or whatever. Normally it's in the 90s, like 96 and to 100 to get to pass. And all we care is that you pass. We'd love for you to make 700 and 720 and all that kind of stuff, but It's okay if you just pass.
So does it tell you like, 106 out of 150?
It's not gonna tell you anything.
What's the highest anybody like has gotten in this?
It's a possible 800, and we've had a 720. Last year we had a 720.
That's what I'm
We
asking,
had a
like, how
lot,
does
we had
the scoring work?
684s, we were
So do
really pleased.
they tell you what your score is if you pass?
Yes, what they initially tell you in a week and a half is if you passed or failed. They do not give you your score then.
Okay.
And then a couple of weeks later, you're gonna get, your score, and then they're gonna give you the breakdown of the 4 areas and to say what you did well in, but they don't ever say, oh, you got 67 out of 80 in this area. They just say, it's musculoskeletal, integumentary, which would be wound care. I mean, there's 4 divisions. And,
So the highest score you can get is 800?
800. And I think our highest was like 728 or something, I can't remember.
Right.
So in the scoring, those 50 questions don't count against you?
No, they don't count at all. You just have to take them. So that's why you need to know, don't worry about it, just get in there and take the test. Never change an answer, never. I'd rather you never do it than go in there with that attitude, because you will fail if you change answers, I'm gonna tell you are. Do not change an answer, especially if you have no idea what it is. Just put down your first thought and go.
So it's out of 800, but you only need 100?
No, it's out of 800
That's what I'm saying, this is pretty good.
I don't understand exactly, you have to make a 600 to pass. And it's 3.5 to 4 points for every question. So usually if someone's right at 600, it'll be 96 questions to 100 questions.
Oh, that you have to get right?
Yes.
I see.
Out of 150. It's all done on, the bell curve stuff. And
Right.
how many people took it that whole year with you is what makes the difference on that. And there are, I think, 4 different exams, so you guys won't all have the same one. So
So they tell you how many questions you got right?
at the end, they don't, you can kind of figure
Or
it
they
out.
just
They
tell you,
actually
like, the
don't tell
600
you, but
score?
you can figure it out, because we can. Like if you come back with let's say a 580, we figure you missed 5 questions. It
Oh,
could be
okay.
4.
Cause I was gonna ask, how do you know if you were like 1 question off?
If you had a 596. Those are the hardest. We've had a few of those. So y'all just pass. It'll be all right. Okay, I have no idea where I'm at. And have you already told me what you wanted? And what did you
It
tell me?
was 2. It was the, one. No, you already
Oh,
marked
you
it.
already did. Okay, spinal cord 2.
We'll do 2 questions though.
What is a posterior cord injury?
Posterior cord injury.
What do you see and what is it?
I think it's